Hi, today we're going to talk about what is normal blood pressure and also the abnormalities with blood pressure. So this is just a little graphic chart. This is in your book, your textbook, but I thought it would be just quicker to recreate it for you here. Normal blood pressure is now considered anything where the top reading is less than 120, and remember that the numbers are expressed in millimeters of mercury, and the diastolic or bottom reading is less than 80. So that would be your perfect or your desired range. It can be 100 to 120 for the systolic to be considered normal, and the lower reading between 60 and 80. The next state that we have is called prehypertension, and I'm going to explain the condition more fully in just a minute. But your readings would be between 120 and 139 for your top reading, and between 80 and 89 for the lower reading. Then we move into hypertension, where you're actually in more of a dangerous condition that needs treatment. And stage 1 is where your systolic is between 140 and 159, and your diastolic reading is 90 to 99. Stage 2, definitely even more dangerous, definitely in need of treatment, equal to or greater than 160 for your systolic, and equal or greater than 100 for your diastolic reading. Okay, now we're going to discuss prehypertension, and this is a state for a condition where the blood pressure again is 120 to 139 millimeters of mercury for the top reading or the systolic reading. And remember, I want to clarify that the systolic means the heart and the arteries are being stressed during the heart contraction phase. And it's always the top reading. The systolic will always be the top number. The diastolic, or smaller number reading, is between 80 and 89 millimeters of mercury in prehypertension. And again, this is the heart in the resting phase, so that's what diastolic means, the heart at rest. Prehypertension is a warning sign that hypertension will develop unless steps are taken to prevent it. Treatment includes proper nutrition and regular exercise. And just a little bit more on prehypertension. Research has proven that prehypertension can harden arteries, dislodge plaque, and block arteries that nourish the heart. So this is why we want to start treatment in the prehypertension phase. Okay. Now we're going to talk about hypertension. This is when blood pressure is greater than 140 millimeters of mercury for the top reading or the systolic reading, and greater than 90 millimeters of mercury for the bottom reading or the diastolic reading. Reasons that people get hypertension: stress, anxiety, high salt intake, the aging process, kidney disease, thyroid deficiency, and vascular conditions such as arterial sclerosis, where the veins and arteries become clogged and stiff. Blood pressure, high blood pressure, is AKA, also known as the silent killer, because most people have no signs or symptoms of the disease. So they estimate that there are millions of people walking around with high blood pressure, and they do not even realize that they have this condition. Untreated, it can lead to stroke, kidney, and heart disease, and the treatment is proper diet, exercise, medications, and stress reduction. Okay, the next one we're going to talk about, next condition, is hypotension, or low blood pressure. Indicated when pressures are less than 90 millimeters of mercury for the systolic reading, and less than 60 millimeters of mercury for the diastolic reading. It can occur with heart failure. The pump is not working properly anymore, and it's not circulating the blood like it should. Severe burns, and by severe burns I mean like a lot of the body is burned, to a high degree of burn. Okay, hemorrhage and shock can also be possible causes of hypotension. Orthostatic or postural hypotension occurs when there is a sudden drop in both systolic and diastolic pressure when moving from a lying to a sitting or standing position. So if the person gets up too quickly, Sometimes their vascular system cannot handle that, and they will feel all lightheaded. Okay, so the blood vessels cannot compensate quickly enough to the change in position. And just a little bit more on hypotension or low blood pressure. The individual becomes lightheaded and dizzy and may have the blurry vision like I talked about before. These symptoms can last a few seconds until the blood vessels compensate and more blood is pushed to the brain. But there are also times when the low blood pressure persists longer than that, and I just added a few ways to treat that. You can increase fluids by rapid IV infusion of saline. That's the way you'll see it treated in the hospital a lot of times if a person kind of has a shift in blood pressure. Or they can just increase the sodium in their diet to raise the blood pressure readings. And that's just a summary of the different hypo, and normal tension of blood pressure.